Hello, my name is Janelle Green, and this is my presentation for PC 700 about the impacts of advanced maternal age on pregnancy. So just for a brief introduction, advanced maternal age, also known as AMA, is pregnancy after the age of 35. Reproductive years are considered normally from teenage years till before 35, and then after 35, your pregnancy is designated an advanced maternal age pregnancy. With that being said, these pregnancies are considered high risk. These pregnancies are literally considered high risk because of the higher risk for advanced maternal age mothers to have adverse outcomes. They should be monitored closely by a maternal fetal medicine specialist or a midwife throughout their pregnancy. Typically, it's easier for women to get pregnant in their reproductive years. However, pregnancy after the age of 35 is possible. A lot of the times, a myth is said that advanced maternal age mothers have to go through some kind of intervention to get pregnant, whether it be IVF or taking certain medications to increase fertility. However, these moms can get pregnant through intercourse as well. Their pregnancies, however, need to be monitored more closely because of the fact that they are considered high risk. So why are advanced maternal age mothers considered high risk? These moms are considered high risk because they are more likely to have comorbidities relating to hypertension and diabetes, and that comes with age. So the three biggest disease process that we usually see with advanced maternal age mothers are gestational hypertension, preeclampsia, and diabetes. I work in a high-risk obstetric population, and we treat patients with these disease process all the time, and a lot of the times they are advanced maternal age. So they come to us where we deal with high-risk patients. But gestational hypertension, we're more so looking for severe range blood pressures with preeclampsia, along with the severe range blood pressures and protein in the urine. And with gestational diabetes, a test is done at 28 weeks, known as the glucose tolerance test. We're looking to see if mom's levels rise to a severe range. Now, with hypertension issues, with the gestational hypertension and the preeclampsia, we're concerned with placental blood flow to the baby, and also the risk of eclampsia, where mom could have a seizure, and as well as stroke with high risk, with higher blood pressures. Mom is more likely to deliver via cesarean section if she has these complications, because there may be a point in the pregnancy where the physician feels as though the baby is safer outside to get some interventions done versus inside of a hostile environment that the baby has been growing in. And along with delivering via cesarean section, mom is more at risk for hemorrhage as well as post-operative complications and infection. So that leads right into, how does an AMA pregnancy affect the fetus? Premature birth is one of the biggest complications. With a premature birth, the baby didn't develop full term to 37 weeks. And with that, the baby may have a long NICU stay where a CPAP or intubation has to be initiated to help with breathing, as well as a host of other interventions that can be done to help the baby grow. With placental insufficiency, the baby wasn't getting the correct blood flow inside mom. So with going in the NICU, interventions need to be done to help grow baby. With blood glucose complications, the baby's size is usually directly affected. For example, large for gestational age babies or small for gestational age babies. The baby's blood sugar also has to be monitored, because if mom's blood sugar had issues, baby's blood sugar normally does as well. So all this sounds really scary. So the question now would be, what can moms do to improve their outcomes? The most vital thing that mom can do is establish obstetric care in the first trimester. It's vital when mom finds out that she's pregnant to go ahead and schedule a doctor's appointment with a physician that she trusts and go ahead and start doing the necessary exams. For example, around 8 weeks of pregnancy is when the first appointment usually is. And a transvaginal ultrasound should be done first to make sure baby is in the right place. For example, not ectopic, but in the uterus. Then once we see that mom is advanced maternal age, mom may need to have certain blood tests done to test for genetic diseases like Down syndrome or trisomy 21, as well as making sure mom's blood pressure is okay. Then, like I said, when she gets to 28 weeks, making sure her blood sugar is okay. So having a good relationship and a compliant relationship with your physician is best. Also going over lifestyle changes, for example, smoking cessation, stopping alcohol consumption, and being active during pregnancy are conversations that can be had as far as lifestyle changes. It's also important to decide if being active is something that is safe during pregnancy, because every pregnancy is different and some moms may need certain restrictions that others don't. So in conclusion, we discussed that fertility decreases with age. Pregnancy after 35 is possible. Advanced maternal age mothers and their baby have the highest incidence for infant mortality and morbidity. However, there are things that can be done early on to catch certain diagnoses such as gestational hypertension, preeclampsia, and diabetes to help mom along the way to make sure that her pregnancy is safe, which goes into why it's vitally important to seek obstetric care in the first trimester so that mom and her physician can have the proper working relationship to have the conversations to discuss what needs to be done, how often her visits should be, what she should be eating, what she can do, and what she should kind of stray away from during pregnancy to ensure the best outcomes for her and baby. That is it. Thank you so much for viewing my presentation. And here are my references.